Hello, welcome to FSCDR TV, Warriors Within. I'm your host, Coco, and we are here to bring awareness to sickle cell anemia and express the resources that need to be advocated for our sickle cell warriors. I have my beautiful warrior diva, Jennifer, here. How are you, my love?
I'm good, and you?
I'm doing well. It's such a pleasure to meet you. I'm thrilled with this one. Um, I just want to really just dive into everything about. Tell me. Let's start with this. Tell me about growing up with sickle cell anemia. You expressed to me that you were misdiagnosed. How? Please elaborate on that because I know this is really the wild part.
Yes. Okay, first of all, the reason why I said I call myself the sickle cell diva because through my childhood, when I was born in 1967, they told me that I had sickle cell trait. So it wasn't until I turned the age of 35 that I decided to change my career because I wanted to be a I wanted to be a police officer. I was tired of teaching school,
Really?
teaching kids that
A police officer?
Yeah, I wanted to be a police officer. And I was like, I'm just done with, the kids and everything. I want to teach some adults
I
something.
agree.
So long story short, what happened was that, let me go back. Because I was misdiagnosed at birth, they told me I had just had the trait at birth.
Okay.
So I never expected to have the disease because they said the trait never goes into the disease.
Yeah.
So what happened was, now I'm going to go forward to when I turned 35. Like I said, I wanted to be a police officer. So I was riding in my car one day, driving down the street, and I said to myself, you know what? I want to change my career. So what I decided to do, I saw this place that said medical records, physicals, everything like $25 because I was just going to go there to get it for free, like $25. I'm like, that's nothing. So what I did, I pulled over, went inside, and I told the lady, I said hi, and I met her. It was a Haitian doctor, never forget her name, Dr. Teresa LaFortune.
Okay.
She said, why are you here? I said, I need a physical. I said, because I'm trying to become a correction officer. She's like, really? She said, well, what makes you want to do that? I said, well, you know what? I'm just tired of the kids. I'm not making a difference. I want to make a difference in someone's life. I need somebody to get in my face, like an adult, so I can see I'm making a difference. So long story short, after that happened, I did the test and everything. She took my $25 and she came back with the form. She said, you have sickle cell disease. You can't pass this physical. And I said, I looked at her, I'm like,
Yeah,
okay.
right.
Yeah, okay.
Yeah.
I said, okay. I said, so I have sickle cell disease. I said, okay. I said, you know what, you're a quack. I said, she said, oh, you are? She said, I'm a quack. I said, yes, you are a quack. I said, you know what, I shouldn't even stopped here because you know what, I see why you're only $25 because you know what you're doing.
Yeah.
I said, just one of my $25. I said, but you know what, you could keep it. I got mad, got in my car, went home, and the next day, boom,
You got sick.
I got sick. And when I got sick, I had this chest pain, like an elephant was sitting in my chest. And I was like, man, she jinxed me. Like, all these years, I never had any symptoms of sickle cell disease that
Really?
I knew of
Okay, even growing up as a child.
as a child. Never. I was always a petite, little, skinny child,
Okay.
sleepy, lazy,
Okay.
lazy. And when I think back,
That's-
that was sickle cell.
Yeah, that plays a part.
Yeah. And I had the yellow eyes. I had the belly, the little pudgy belly.
Yeah, the little
I was
pudgy
this
belly.
big, but my belly was always there. So anyway, so I'm like, so this is real. So I called the paramedics. They came, and they said, what's going on with you? Like they knew me because they went to school with them. They're like,
Yeah.
oh, here you go, Jennifer. What now? Your gallbladder was just taken out like a couple of years ago, so now we back. And I said, no, I said, I don't feel good. So anyway, so after that, I got to the hospital, and it was just telling me that you have acute chest syndrome. And I was like, okay, if that's what you all say. So I was like, okay, because I was like, something is wrong with me. So after that happened, time passed. I just was like going to the hematologist, just like getting regular care because I knew that from 35, that I was diagnosed, with
Yeah.
sickle cell. So I started going to my hematologist every month, just doing the right thing. And then, bam, 2013 hit. I had a major headache, couldn't, just like miserable. Father's Day weekend. And I was thinking because I was missing my dad, not thinking it's sickle cell or anything wrong.
Yeah.
I kept saying, well, I'm going to feel better. When I feel better, I'm going to go to the Sickle Cell Day Hospital at Memorial Hospital and get treatment for the pain. Then I remember Sunday morning, it was Father's Day that year of 2013. And I said, I need to see my dad. So I left. I went to my dad's house. I saw him and my daughter. He was like, baby, he I just had been diagnosed with sickle cell. So he was like, baby, you may need to go to the hospital. And I said, okay, Daddy, I'll go. So after that Monday morning, I had to make sure my daughter go to school.
Yeah.
Because I think she's going to summer school or something like that. It was happening over the summer. And I was like, I got to get out of this house. I was like, Mama, I got to go to the hospital. So I got in my car, got in my truck, rode to the hospital, went, checked myself in, and I kept telling them, I have a headache. And they kept saying, okay, so, you get your IV pain medication. They gave me a round of morphine, and I came back again, another round of morphine. And I kept saying, something is wrong. And they kept saying, Miss Williams, we're giving you like the dosages like I think they gave it to me every 2 hours because I never complained of a headache like that.
Yeah.
Then all of a sudden, when they gave me the last, it was 12 o'clock, I got dose at 8 and 12, that's right, that was the second dosage. So all of a sudden, when they gave me that, I just said, ooh, I grabbed my head, and that was it.
Wow.
I heard them say, stroke alert, in Memorial Hospital. They ran, came and got me upstairs. When I woke up, I think I might have passed out.
Yeah.
I woke up, I was downstairs in the ER, and they were doing a procedure to try to reverse the bleed on the brain, because I didn't, I'm just new to sickle cell, so I'm like.
So you weren't aware of any of this.
Yeah, and they said, you're going to be here for 6 weeks. You've had a massive stroke. You have both, this affected the right side, but it did a little damage to the left side as well. So, by me being Jennifer, who I am, I'm always a strong person. I'm thinking about my family and my students at school because I'm a school teacher. And so I was like, like, Lord, a stroke. And I was like, how? And I was saying, Lord, I can't.
Yeah.
And I said, I'm a sickle cell diva. I said, how we gonna walk with, I'm
Yeah.
gonna walk with a limp and all this kind of stuff. I said, God, I'm not ready for this. So I was like, Lord, whatever you do, you just allow me to be a diva. I just wanted to just like raise my children and, my grandchildren as well. So anyway, after that happened, that night I was in the hospital. I was angry. I was like crying. And then I said, God, I know you're real. I said, but God, I can't accept this. I can't move. I can't go to the bathroom by myself. I was angry.
Yeah.
Because I was like, I was only like 40 years old. And I was like, this can't be the new norm.
Yeah.
And then all of a sudden, the doctors came. They said I had my stroke at 11:59 that morning before 12 noon. 11:58, 11:56, they came to my room to tell me they need to put me back into the machine. And I was like, I was bargaining with God. I was just telling God, I know you're real, God. And all of a sudden, they put me in the machine, and I heard them get quiet. They called another doctor. They said, look at that. And they said, it's gone. And I said, what? They said, somebody loves you. I say, God. And then they said, Miss Williams, we don't know what happened, but the bleed on your brain is gone. But you're going to have to be here for another 6 weeks because, you have a foot drop. It's telling me, like, all the damage that was caused.
Tissue right there, grab it.
And after that, I just prayed and talked to God and just was like, you know, just thanking God for life, health, and
Yeah.
strength. And then the first day they came to do therapy with me, that was the first day. Second day, third day, I call it Father, Son, Holy Ghost. Because on the third day I walked out that hospital. I walked. And I know that was nobody but God.
Yeah.
I told them, they said, you can go home. And they said, well, we'll call your dad to come pick you up. I said, no, I'm going to drive home.
Yeah, because you drove yourself there.
Yeah, I drove myself there. I had a big truck. I was driving a Ford Expedition.
Oh.
So imagine me
And
in that big old car.
yes, and on stroke territory
Yes.
at that is nothing but God covering you that whole way there and the whole process.
And then what happened? I was dragging my leg and I jumped up in my truck and I drove like a man. So I was like doing my thing. I was like listening to my music. I was listening to I can't think of her name right now, but it's a song that she would sing, Yolanda Adams.
Okay.
About something I have to pass this test. I'm gonna be ready.
Okay.
And I was ministering to my heart. I was crying and thanking God.
Yeah.
I pulled up. My mom has like a U-shaped driveway. I pulled in that car. Backed up. Got out the car. Drug this leg. Put that leg down. Hobbled to the door. They said, Jennifer. I said, yeah, Mom. I'm home. And after that, it was nonstop. Nothing could stop me then. But then, in the year 2010,
Take your time. If there's tissue, whatever you need to get.
my brother had gotten sick. He had the traits.
Okay.
So, somebody so strong, that was my rock. I had to take him to the doctor because he was dragging his feet and like he was punch drunk. And I said, Lord, just
Let him be.
let
him
my
through.
brother be okay. And he wasn't. The doctor said he can go back to work. He said he has COPD. He's going to be just fine. And I let her have some words I won't say here. I told her, you're going to remember my brother. You remember, nobody's going to remember Gary Williams. You're going to say his name. I said, he's going to haunt you. I said, there's no way he has this. He has multiple sclerosis, and he can go back to work. And he has COPD, and he can barely breathe. Fast forward to a couple of months past. I saw him one day. I went to see him. And I said to him, I said, brother, it's time for me to lean on you. No, you're to lean on me because I'm the big sister now. I said, I don't believe you have COPD. I don't believe you have anything. I believe that you have sickle cell disease like me. I said, but we're going to let these doctors say what they say, but we're going to get him. We're going to get him. So after that happened, he's in the hospital. They said he had multiple sclerosis.
Yeah.
They said he had COPD. I said, well, why, where's his spleen? You guys said he had a spleen. My spleen got absorbed in my body. He did the same thing. So how is it possible that, his spleen just walked out? I'm like, just tell me how did that happen? And they said, and I said, he had to have his gallbladder removed. I said, and guess what? I had the same thing.
Yeah.
I said, so can you please test him for sickle cell disease, not the trait?
Yeah.
He has the trait, but he has the disease. So they said, no, okay. Fast forward. He was going to therapy. I'm looking at him getting worse and worse. Worse and worse. Can't breathe. A week before Thanksgiving in 2010, he was supposed to go to therapy. And I'm his biggest cheerleader. I'm fussing him out on the phone. I'm saying, if you don't get to therapy, I'm going to do this, I'm going to do that. And I said, remember last time when I saw you in your diaper? I was like, that's not you, brother. I said, you're my hero. I said, when Dad walked out on Mom, you stepped up to be my brother. I said, you the best brother I ever had. I said, you my nigga. I told my brother that. And he said, if I don't get no bigger, I said, yeah. And we laughed because, I'm short and he tall. So that made me smile. Then I said, but I couldn't shake the look on him. Because I said, Lord, I see my brother in a diaper. My brother got in a diaper.
Yeah, that means he's...
I said, he's given up. He texted everybody that day. He texted me. On Monday morning, we had a joke that I always say, time to make the donuts. We was like Dunkin' Donuts. He texted me, say, time to make the donuts, sis. And I said, okay. I laughed. Then everybody was saying they had to text him, Gary, like, what's going on? Gary's texting everybody, like, see you this day. See, we're going to get together for Thanksgiving. All kinds of stuff he was texting. He told my sister, happy birthday, because they went to take him to therapy, because I was, like, upset.
Yeah.
He wasn't going. So when they said he's not going to therapy, I just said, well, y'all go over there and talk to him. So, because I said, if I go over there, he going to go to therapy. I said, because that's my brother.
Yeah.
So
He
anyway,
was gonna go.
I said, for me, for Jennifer's baby, he going to go. So my mom was there with him, and he was like saying, telling my mom, you need to go, Mom. You need to go. And she said, son, like he had defecated on himself.
I got you.
And he was trying to make my sister and my mom go. And then he told my sister, he said, happy birthday, Tracy. And she said, Gary, my birthday not till Thanksgiving. This Monday. Thanksgiving is Thursday. He said, but I'm letting you know, early birthday. Nothing.
Nothing of it.
He didn't go to therapy. He didn't want to go. He told my mom that he loved her. He told my sister that he loved her. And he said, I'll be okay. He said, Mama, please go. Please go, Mom. And she said, Gary, I can change your diaper. Mm-hmm. You're my son. And he said, kind of angry. He's kind of angry, kind of rude. He said, Mama, please leave. Yeah. I got to go to the bathroom. He had a massive heart attack. And they found him on the floor. My nephew found him on the floor. They called me at work. They said, Jennifer, Gary just died. I was running through the church. I worked at a church, an all-boys school, Mount Hermon. Mm-hmm. I ran down that church, thanking God. I said, God, you're good. He's in a better place. I cried from my soul.
Yeah.
I called my sister because I couldn't drive my big truck.
Yeah.
Because I was like, I couldn't see. I was like I was like my own rainstorm in my face.
Yeah.
My sister came and got me. We left. And then we went to the house. Paramedics came. I'm trying to get to see him. I'm fighting the paramedics. I said, this Jennifer. I said, I'm his sister. I said, that's my brother. I said, he going to get up for me. I was in denial just that quick. I said, he's going to get up. He's going to get up because this Jennifer. And they says, you don't want to see your brother like that. I said, I need to see him. I need to see my brother. So they said, well, we'll get him cleaned up. And my parents were there. My mom and dad made it to the scene because he was home with his wife. And time passed. I was sitting out just, crying and everything. People were coming over. And when he died, it looked like he had a look on his face like struggling, like
hurt.
Like,
yeah.
This hurts. Because I got a glimpse of him. I ran from the paramedics, and I got a chance to see him. But he was dead, and I was like, I looked, and I said, yeah, he's dead. So they came out. They brought him out. And then everybody wanted to see him because he was such a good person. I didn't want nobody to see my brother because that was my brother. I didn't want them to see
Like
him
that.
like that. Remember him from
Good.
Dad, the good way. But I thank God for that vision because when he died, he was on a stretcher. Like, I say he was transitioning. He was talking to God. I said that. I couldn't believe he was dead. I went to the funeral home. I asked, could I see my brother? The man said, I don't know what happened. By the time, that was a Monday. I went up there that Tuesday because I couldn't sleep. I said, I got to see him. The man brought him out on a gurney.
Yeah.
Smile. Brother had a smile on his face. And I was like, he said, we didn't do that. He said, we didn't do that. I say as well. Yeah. And I said, brother, I said, you made it. You made it. I know you did because in the hospital I told him, to, convert his life over, confess of his sins. He did all that. I called my pastor. So it was well, but hindsight is 2020. And I look at it as that he was misdiagnosed just like me.
Yes.
But the good thing about it, they had to change his death certificate because I was adamant about
putting the right thing on.
Yeah, and they said we had an autopsy performed on him. He was going to sue the hospital, but he couldn't because, he was married, and so his wife just accepted. She accepted what he had. So then all of a sudden, the day of the autopsy was being done, they wanted all his siblings and his children there. They called me. I was crying. And then they just said, does anybody in this family have sickle cell disease? I said, me, and she couldn't hear me. Because we was on a conference, a telephone conference. I was at my house, and we was just on a conference call. And I said, me. She said, who is me? I said, Jennifer's baby sister. She said, well, I just want to tell you, he was the strongest person that I know. She said his body was riddled with blood clots. Jesus. Not one day in the hospital. Glory. Not one day of pain treatment for sickle cell. Glory. And then she said, because of who you are, you now have your brother's actual diagnosis. Because of your persistence on being that he had that autopsy done, now we can change the autopsy to complications of sickle cell disease. And it was well. I was okay with it.
What did the death certificate state before?
It stated COPD, multiple sclerosis, something else. Oh, stroke, heart attack. Was he did die from a massive heart attack because when he died, he was clutching his chest.
Yeah, but that's common with sickle cell.
When he fell, he was like, because my nephew found him dead.
Gotcha.
My nephew found him dead. His 14-year-old son.
God bless him.
And I just was okay.
So I want to ask, how did that affect your family? Because I can only imagine, like you said, 35 being misdiagnosed. And how old was your brother?
51 when he passed.
And we talk about the life expectancy.
Yes.
So you and your brother beat the life expectancy that they normally put out there.
Exactly.
Let's start that.
Yes.
But to be misjudged, misdiagnosed, I can only imagine. 35 years, you was living life.
I'm in my prime, baby.
Yes.
I'm like, living my best life.
And then next thing you know, it's a major adjustment.
Yes, it is.
How did that affect you mentally?
I was depressed because I know I had a death sentence because of what I was told by other warriors.
Yeah, well, the
I'm
scare
like,
factor.
I'm like, girl, I'm 35, so I beat y'all. Like, I ain't got no tag on my toe at the age of 18. I'm like, no, I'm not. I said I'm gonna be a long time. Just trying to pep myself up. And then, I had the strokes because I've had 6 strokes.
Yes. Oh, wow.
And that's a major adjustment because now you have to take medication for blood thinners. You have to take medication for pain. And I was pain-free for 35 years.
Yeah.
I never took anything for pain. I was like a trooper. That's why I say I consider myself to be a warrior because I'm like, I said, look, I had 3 children.
Yeah. And that's one of the complications we talk about on this podcast as well.
But they said, well, your blood is so low. I said, yeah, I have the trait. They said, you want to transfuse? I said, no, I got the trait. I want to go on to my babies. And I just would get fluids and build it back up.
Wow. That's amazing. Because, see, to side note from you, I have a trait. And with my baby, I had to have a blood transfusion.
I was supposed to, but I didn't even know I had sickle cell. I didn't know. They just kept saying.
Yeah, and see, it's little factors like this. Like I tell everybody, I'm like, these are they're tedious things to know because they last you a long way.
Yes.
So with the major adjustment to find out you're 35, now you got to change your whole regimen. Because you can't, now like you said, you're on blood thinners, and that's usually... How does that work? Because normal sickle cell patients, you know what I'm saying? Like, their blood cells, and then you're on blood thinners. So how do you make that balance? Like,
okay, what happened for me? All I was taking was pain medicine.
Got you.
And folic acid. That was my regimen till I had my first stroke in 2013. So that's when I started taking an 81 milligram aspirin.
Mm-hmm.
I had to take, I wasn't on blood thinners though. I wasn't on blood thinners till I had the second stroke in 2017. Another stroke in 2017. And that's when Dr. Gershwin Blyden.
Shout out to Dr. Blyden
okay.
again.
And Dr. Blyden, that's my daddy. I call him my daddy. He came to hospital to see me. Like.
Yeah. It's the compassion that he has, and I know exactly where you're coming from. He is so detailed, and I'm gonna look in the camera and say he is so detailed.
Yes.
If it's any hematologist, we promote him.
That's
because
right.
He is detailed. He's compassionate. He's understanding. He really, I agree with you. He hits it on a nail, and I have yet to find He's a rare gem.
Yes,
a rare gem.
With me, every time I had a stroke, Dr. Bronte was there. They were coming for me. And then Dr. Blyden, the second stroke I had, it was like a major stroke because of the first one was like a major one, but I bounced back in 3 days. But with this one, it did right side damage. I had it was a major. Okay. And when I saw the look on Dr. Blyden's face, I knew I was in trouble because when he came to see me, he's always catching me eating the wrong foods, and he'll just look at me like,
you don't know no better yet, huh?
He's always catching me in the hospital ordering my red velvet cheesecake from Cheesecake Factory. So the look on his face, I knew I was sick.
Yeah.
And he had tears in his eyes. As strong as he was, when I saw him cry, I say, it's serious.
Yeah.
And he did everything stat, blood exchange. They gave me new blood as well. They put a
PICC line
in my neck so I can get the blood transfusion. First time ever having one.
We talked about this earlier. I've honestly just went through this recently. My son, we talked about the gallbladder. Mm-hmm. My son had gallstones, and he just went through the same thing, and it was the most scariest thing. Yes. As a parent, I was furious.
Yes.
I was furious because I never seen nothing like that a day in my life. I was sad, I was hurt, I was confused, I had so many emotions. But I had to, like how you said, I'm his warrior, so
Yeah.
I'm strong for him. So I'm like, you got this.
You got the mama up.
Yep. I
Yes.
was like, you got this. I'm looking at the whole process during it, and
That's right.
guys, it's not an
Easy.
easy process.
It's not.
PIC lines are, I'm gonna explain to the audience real quick. PIC lines is something that's inserted either in your neck or in your arm
Yes.
for either blood exchange and
Yes.
for any type of medication to be received, and it has to go straight
But also,
in.
I have this in my chest. It's
Okay.
up here now. I wear it proudly.
Okay.
That's my port. I had one over here, but they had to take it out.
Mm-hmm.
Mistake. They took it out by wrong. It wasn't infected, but
Okay.
I'll let them do
Yeah.
that. They did it, but I got a new one.
Okay.
And I have a new port, and now this is where I get my medicine at now. But
Okay.
with that one,
The PIC line.
the one that I had, the PIC line, I recall them giving it to me through here, the
Okay.
pain medicine through here, and the blood
Through your
and everything was in my neck.
Yeah.
And then I also had the one where they had to cut my neck. Horrible.
Oh my
And
goodness.
sew it up and put this tube in there.
Ooh.
And it's like when you get dialysis.
Uh-huh.
I had that one.
Okay.
And that one
And
was scary.
Yeah, because like I said, that has to. I'm putting myself in your shoes, and I'm not 35 yet, but
Okay.
soon when I get there, I hope I look good like you.
Okay.
And I'm just putting myself in your shoes to be 35, and then like I said, just have a whole turnaround like that. What was your support like? Because I know after your mom,
Devastated.
yeah,
Everybody
like
was devastated
after
because
your
they're like,
mom witnessing this, your family, your brother, they had to be like, zoom, tunneled in on you.
oh,
Now,
my mom,
yeah,
it's hard because she has dementia now, but
God bless her.
I'm her baby, and I miss her. I miss her because whenever I was sick with the crisis, I would go home. She'd come to my house and get in my bed,
And lay with you.
feed me, pat me to sleep.
As a mom, what we do.
Yes. But my support system is great. I have a daughter that's a nurse.
A beautiful, beautiful.
She wanted to be a hematology nurse, but because my grandson, Makai Beasley, he has sickle cell type SS, and it was hard for her to see him because she worked at the hospital she trained at the hospital. He go to Joe DiMaggio, same way that your son goes
Yes.
to. So she was like, she couldn't deal with the kids having cancer
Yeah.
and sickle cell. So
I agree.
she wants to be a forensic nurse now.
Kudos to you, mama.
And so she became my rock
Yeah,
because when I'm being mistreated in the hospital,
she speak up for you. Because she knows the ins and outs. I always tell somebody that you
need a good support
you
system.
do need a good support system. And I'm going to dive into this topic on next one. Most of the time, they're surprised at the support system sickle cell
yes.
patients have.
Okay?
So let's dive into the fact of, I've asked every warrior this. Because that was you say you were misdiagnosed, so you didn't get the chance to go through the pediatric
None of
side,
that.
like
None
how
of that. None of
everybody
that.
else tell you, oh, I went through pediatrics, it was great, and then I converted over and I'm adult and it's horrible.
Yeah, I've heard that though.
So
I've heard
have
that.
you had an experience where when you've been sick and you just felt like you just need better attention from the hospital, that they're not doing what they
I'll
need
just
to?
give you a brief synopsis. Being that I was diagnosed with sickle cell so late in life, my grandson had sickle cell, and I'm the type of person that we can mask our pain. I can get my phone. I can, my boyfriend sometimes he'll talk to me and send me like funny jokes or whatever, and we just be laughing. So this particular incident, I was in full blood crisis, and my daughter called me and said, Makai is in the hospital. He's over at Joe DiMaggio, and I'm here at Joe DiMaggio, and he's right across.
He right across from
I could
me.
just look out the
Hospital window and the
see-
skywalk.
and I'm like, Makai's over there. So I'm in the ER, and I was like, I came in there in pain, but I'm on my phone, laughing and joking. So the doctor walked in and said, you're discharged.
How?
I said, how? I said, why? He said, you're discharged. And I just said, I didn't get any treatment, though. And the nurse said, I said, well, call upstairs to the Sickle Cell Center because they sent me down there because I'm in a crisis. We called up. There was a mistake. They thought I did get treatment. I didn't get treatment that day. No treatment at all. So the doctor told me I had to leave. Full crisis. But because I was being myself, singing on the phone, can't sing a lick to my grandson, you know, saying, Makai, like,
you trying to cheer him up.
I'm trying to cheer him up because he's a baby.
Yeah.
So that was a bad experience for me, you know, because they were like, and also they just say, like, you got sickle cell?
Yeah, because you don't look like it.
One doctor told me I was fat. She straight out told me I was fat.
No.
She said, you're too fat. And I was fat, and I'm not going to lie. I was like 170. She was like, she's like this, making her face like, and I was just like, okay. I said, but I have sickle cell disease, though. And she was just like, how? Because she was just saying how good I took care of myself.
Yeah.
And she said, I'm healthy. And she said, well, like, what do you take? And I said, pain medicine, that's it. Like hydroxyurea, no. All this medicine, I was like, no, I don't take anything but my pain medicine, hydrate, coconut water, aromatherapy, stuff like that. And I was just like, the fact that you go there looking, because I was, like I said, I was born for this.
Yeah.
I had to be.
Yeah.
Because
for sure.
I played the part.
Mm-hmm.
And when I was playing the part, I said, I stood up for myself. I began to say, ain't nobody finna treat me any kind of way. I'm not no addict.
Nope.
I'm not no pain seeker.
Mm-hmm.
I have pain, and you're gonna take care of me.
Yeah.
And then there were times when they were like dogging me, but when they saw that the condition of my body and they read the chart, 35, and here she go 42, and they're like,
yeah.
And first thing they say, they told me, when did your first crisis develop?
And when you tell them the age, they think it's
and they be like, and they said, how did you get sickle cell? And I say, next, I need another doctor.
Yeah.
How did I get it? I said, you're a doctor?
Yeah.
I said, you need to read up on sickle cell. So, but they would be like, I'm just healthy. You know, I take care of myself. I was an educator, school teacher. So they was like, how? You know, like, what did you do? If I did have pain or anything, I was a lazy child, but I don't recall like being, I was greedy.
Yeah.
Real greedy, craved sweets, but I never was like, I don't recall pain. I remember one time I was 14, I had walking pneumonia, but it probably was acute chest syndrome.
Yes.
Because I thought I was going to die. I just felt like an elephant was just sitting on my chest. And my brother, Gary, he said, sis, I got you. He walked to the hospital because, you know, my dad was gone. He walked to the hospital, got my medicine for pneumonia. And I miss him.
I can only imagine. I can only imagine that your story is so unique and beautiful. It's so inspiring because you hear different aspects, but this is the first time I've ever heard a misdiagnosis. Twice. I was getting there twice. Because normally they are so adamant how they try to hit it on the money about sickle cell testing and everything like that.
But listen to this.
Mm-hmm.
Okay, my brother died in 2010. So don't you think that 2020 they should have not been able to misdiagnose him? I'll take 67.
Yeah.
I'll go back to 67. I'll give them that. But 2010?
Yeah. I was just going to say that. So what do you feel and think that, as in that care, for testing wise, because that's an inconvenience in anybody's life.
Yes.
To go out through life knowing that you're thinking you're normal, and then out of nowhere you change up your whole regimen. Yeah. What do you see in the future? Because now, like you said, that's 2010. I can understand that in 1960 something. Exactly. I can understand that then too. What do you think that we can do as a community to make more awareness so there's no more misdiagnosis?
My thing is that what I feel is that there needs to be women as well as men. They need to know they need to know if they have the trait, the disease, or whatever. Because when I look at it, the trait was just supposed to be the trait. Now you have people here with the trait experiencing what an actual sickle cell person with a full-fledged disease goes through.
Agreed.
Mind you, I was on a support group from Cayenne Wellness. I don't want to, I'm just saying, but them, they had laid on the phone. We were on the internet. We were on a support room, Zoom, and she has the trait. Gallbladder removed.
What?
Spleen gone.
Okay.
But she got the trait. She has a trait. I don't remember the trait that she had, but her type of sickle cell trait, you got side effects of the disease. How about that?
I do understand that. I tell my son that sometimes it's weird. When
Yes.
he gets sick, I get sick. And I'm like, I call it my godly and womanly
Yes,
like mother
intuition,
thing. Yes.
intuition.
Because if my baby down, I'm down with
Okay.
you, boo. So I tell people all the time, a lot of my friends know very well with my son, but they know when I get sick, Coco I'm not talking to nobody for 2 weeks, because that's literally and I noticed the same thing with my son. It takes me a longer time to bounce back.
Yes, it does.
And I agree with you. It does need to be more awareness and education testing
Yes,
for
it does.
traits and
The trait, because
yeah.
I don't know if you recall, it was like, I'm not good with dates because I've had my stroke, but I used to know the date. It was a young guy in Miramar. He was running track and playing football, and he died on the field. His mom ran out to the field and said he has the trait.
Yeah.
But when he passed away, he did have the trait, but he had complications. He had like acute chest syndrome on the field. He had pulmonary embolism. So I just feel like they're doing a lot of testing, I could say that, but I just feel like we as women, we need to know our status. That, look, we need to know that if we have the trait, at least if we have the trait, we can take it from there. But the trait starts with the disease, you know what I'm saying?
Yeah.
So I just feel like more needs to be done with women and children, because they do find out now, because I'm going to let you know, my grandson, how good God is. I've heard people say they didn't find out till their baby was like 6 weeks old or whatever.
I didn't find out until my son was 7 months.
God is so good.
8 months. And then after that, guess what? He got sick. And I said the same thing you said. I was like, this lady done jinxed my baby. I was like, because now I'm in the hospital.
Yeah, I told that lady, I said, oh, quack.
Yeah.
I said, and I went back and I apologized.
I did too. I
had to
said
go back
the
and
same
apologize.
thing. So we
I
in
had
the
to let her
same
know
boat.
that, I'm so sorry. And, I had to, I was prideful, but I had to swallow my pride.
Yeah, yeah.
Because I was adamant I didn't have it. But with my grandson,
How old is your grandson, by the way? I want to ask that.
he's 12.
Oh, and shout out to all the little warriors.
That's right.
The little baby warriors, because we love them for sure.
And Makai was born. I was angry. His mom had the trait. She knew she had the trait.
Okay.
Guess what?
The dad didn't know.
Dad didn't know.
Same situation.
But I was so upset because I said, you know what? You knew you were having kids. You should have gotten tested for the sickle. You should have had your partner tested for
Agreed.
sickle cell trait, disease, or whatever. But he's here now. I love him. And he's Makai, messenger from God.
Yep.
And I always say, why are you naming him Makai? I said, all your kids got fancy names, Jada, Terrence, and I said, Makai. I said, so you going biblical on me? He said, Mama, Makai's special, and he is. And the first day of life, he was diagnosed at birth.
Wow.
At birth.
So they found out
Same day,
expeditiously.
a couple of hours he was born. He couldn't keep his body heat.
Okay.
He
His
had to
eyes
go
were
under,
pale.
Yeah, he had to go up under the
light.
lamp, jaundice,
Mm-hmm.
and
Yeah, that was kind of my situation too. I was a young mom. I had my son when I was 18.
me too, my
And
first.
I was confused too because they kept telling me, they're like, oh, his eyes are red. I mean, his eyes are pale. He's normal. You know, his skin color hasn't came in. They let me go. And I'm like, okay. And the doctor kept telling me, put him in sunlight. So I'm like, what does she mean, put him in sunlight? Like, I'm supposed to just sit him in the sun? Like,
I know what you're saying. I usually put them in the sun, though you do.
Yeah.
You take them out there in their baby carrier. You let the sun get to them. Or you open up a window, that the sun comes in, and you put that baby on that blanket, no clothes on, put the diaper under them, and let that sunlight hit them.
Yep. So that's what my mom taught me. And like I said, it took 6.5, 7 months. That's when I finally got a call, and they were like, hey, we need you to come start. We scheduled you a point. It was actually his pediatrician.
Yes.
His pediatrician is very amazing.
Dr. Schaefer?
No, Dr. Schaefer's his hemo.
Oh, yeah, that's right. That's right.
His pediatrician is Dr. Ocasio.
Okay.
Dr. Ocasio calls, and she said, we set you up already with a hematologist.
Wow.
This is this. She gave me a rundown. He has sickle cell. This is what you have to start doing. This is what you need to do. Your first visit, and she kept, like, her nurses kept it really real with me. They're like, you're going to be uncomfortable your first visit. And I'm like, why? Like, what's going on? And all I can remember is just going in the house and just breaking down, crying, because I did not have no understanding on what it was. And I told myself from there on, I will make myself fully aware, knowledgeable of everything else, because I totally agree. I have the trait, and my son's dad didn't know he had the trait. So it could have been something that could have been prevented down the line.
That's what I said with my daughter, because I was like, you know, I was angry. I said, like, who wants a sick child?
Yeah.
I said, you know what I go through. And then, but I was like, he's here now.
Yeah. So how does your daughter cope with it? How does she handle it?
She's strong.
Yeah, because I got to imagine being a nurse and everything.
No, the one that's my oldest daughter.
Okay.
I have a 40-year-old. And that's the one that has the son with sickle cell.
Okay.
She's a trooper. She better than me. Because when all I see is I'm like, but I'm strong for him. But when he got a crisis, I'm walking out the room.
Yeah.
I'm crying. And I'm like, he's like, Nana, are you okay? He like, Nana, I'm not sick like you. You know you got pain. And I be like, look at this boy telling me, like, he's okay. But I'm questioning the doctors, because you got to remember now, I was diagnosed at 35, so I never went through what he went through.
Yeah, so you seen it differently.
We had to learn. Makai was our protege.
Yeah,
like we had to learn from what he was doing.
Yep.
Like we had to like Google what's going on.
Yeah, what's
like,
the spleen? What to do with this?
Hand foot syndrome.
Yes,
stuff like that.
Yeah, exactly.
So it was like he was our test baby.
Yeah, I agree. My son too. He's the first one in our family with sickle cell. And I truly believe, honestly, any sickle cell warrior I have met, God put a special covering over everybody's life, because the inspiration that you guys provide. You alone, just me and you, for like, we only talked for 5-6 minutes, and I could feel the overwhelming of your strength, your perseverance. So
Thank you.
I say this to say, I want to, get some positive feedback on this. What do you have to say to anybody that is sickle cell anemic, that that's been misdiagnosed? What positive aspects would you have to say this on an ending note?
Keep fighting for what you're going through. Don't let the doctors tell you anything. Find out for yourself. Learn your disease for yourself. And just be resilient. Just act like, because in the Bible it talks about a sickle. A sickle is a tool. So we're a tool from God. We are the ones that reap the harvest. A sickler goes and cuts down stuff. Mm-hmm. So guess what? We're mighty. Mm-hmm. We have the ability to cut down things. You know what I'm saying? So we're a sickler. I don't mind being called a sickler, because people say, "Oh, that's a derogatory name." What am I? A sickler.
Yeah, when you
all
go in pain, exactly.
When I'm in pain, I'm a sickler. So, but it's like knowing that that's part of our history, the Bible.
Yeah. With
sickle cell, it's a tool. It's actual tool.
Yeah.
So I look at it like, keep fighting. Don't give up.
And this is why I said you are the sickle cell diva. I love this. And I just want to wrap this up. Thank you so much for coming, Jennifer. It was a pleasure talking to you.
Same
And
here.
I know we are going to get our beautiful your grandson and my son, and we are going to get them together so that way they can do great things.
Yes.
And that concludes the episode with my sickle cell diva. Thank you so much.
You're welcome.